All right, so the next part of the axial skeleton we're going to talk about is the actual vertebrae, okay? We have at the top, we have the cervical vertebrae. There are 7 of them. The mid-back, the thoracic, some textbooks call it the dorsal spine. There's 12 of those associated with 12 ribs. The lumbar spine is the low back, and then below that we have our sacrum, and below that we have our coccyx. The coccyx and the sacrum, there are 5 segments of sacrum which fuse when you get to adulthood, and you have between 3 and 7 bones of your coccyx. Now, I don't like to say the word coccyx very much because it sounds like coxal or the os coxae for the ilium, the ischium, and the pubic. So sometimes I call this the coccygeal bone, and that kind of stands it out. Coccygeal is another way of saying that bone. Okay? So we have 7, 12, 5. Think of eating breakfast, lunch, and dinner at 7 o'clock, 12 o'clock, and 5 o'clock. And then 5 bones of your sacrum. They fuse again into 1, and then 3 to 7 of your coccygeal bone. Between the first 2 bones of the neck, C1 and C2, there are no cartilaginous discs. There are no fibrocartilage. But we do have cartilage or disc below C2 all the way to below L5. Okay? And these are the things that can bulge or rupture or herniate, affecting both the spinal canal, patency, or the foramen. So when we talk about an average vertebrae except for C1 has a body. That's here. Or actually, I'm saying here, it's like this. The back sticks out is the spinous process because it's sharp. Sticking out to the side laterally is the transverse process. Between this part here called the pedicle, transverse, and then this thin area here is called what? What's this thin layer here called? The lamina. And they used to, when they were trying to relieve back pain, do what was called a laminectomy or a bilateral laminectomy. And on X-ray you can see that because they removed both the lamina, they removed the spinous at the same time. In every typical vertebrae, there's a body, a spinous process, a transverse process, a pars or a pedicle, and then a thin lamina. Yes. In everyone. Yeah, you have a question? No? This central hole, the central canal, or the spinal canal, that's where your spinal cord goes. Okay? Your spinal cord. And think how small the spinal cord are. Technically, in the low back, the spinal cord stops around T12L1, and the individual nerves go down the lumbar spine. It's called the cauda equina. We'll talk about that later. Okay? But for the most part, your cervical and your thoracic spinal cord goes through this central canal. All right? So what makes these things different? Starting off, the cervical vertebrae, the first 2 cervical vertebrae have their own names. The first one is called C1. C1 looks like a keychain. It's called Atlas because it holds up the skull. Okay? The second one is called Axis, and it acts as an axis for rotation of the neck. This is a pivot joint. Your radius and ulna is a pivot joint. They're the only 2 pivot joints in our body. So they allow us to turn our head. Anyone ever heard of a burst fracture? Huh? If someone dives into a swimming pool, C1 can burst. And a Jefferson fracture, if someone gets hung, this what's called the odontoid process, or the dens, shoots off and goes into the spinal cord and kills you. Okay? So on C2, you have this odontoid process, or dens, that arches around as a rotational pivot point for rotation of the neck. Okay? Now what's also unique is the transverse process in all of the cervical vertebrae have these transverse foramen, these holes that are going to allow the vertebral arteries, which is one of the blood supply to the brain, to be protected along with the common carotid arteries, or more specifically the internal carotids. So we have these transverse foramen that are going to allow for arteries and veins to give blood supply to and from the brain. Okay? None of the other vertebrae have it. So again, here's another C2, C3 or C4, or C5 or C6. They have transverse foramen. They have tiny bodies. Their spinous processes are sometimes bifurcated like a snake's tongue. So you might see 2 processes, not just one. But that's what makes you say, oh, this is a typical cervical vertebrae. Transverse foramen, tiny body, bifurcated spinous process. Here's the lamina, there's the pedicle between the transverse and the body. The thoracic vertebrae, I hate saying this, looks like a giraffe. Okay? The spinous processes are long, blade-like, and the vertebral bodies are bigger. There's no holes in the transverse foramen. And we have these costal vertebral facets or demifacets that are going to act as an articulation for part of the rib, and the other part of the rib is going to attach to the anterior portion of the transverse. And we're going to have two places of rib attachments so that our ribs can hook in to the vertebrae on the top and the bottom, and also into the transverse. And these are our joints for the rib. Because every time we breathe in, the ribs go up. Every time we breathe out, the ribs go down. Okay? So that's what makes the thoracic spine. The thoracic spine, rib articulations on the transverse and bodies, bigger body, no holes in the transverse processes, and the spinous processes are longer and they go down. 12 of those. The lumbar spine has the biggest body. The biggest body. Their spinous processes are blunt-like or very snub-like. And again, there are no place for rib attachments, and there are no holes in the transverse. So on the practical, he wants to identify C1 and C2 by name, atlas and axis. He wants to identify the thoracic and the lumbar. And again, you'll probably see the sacrum laying out by itself, and he just wants you to know the sacrum. Is there anything else on the sacrum he wants you to know? The promontory, the hiatus? No. Just there are 5 segments fused, and the coccyx is 3 to 7 segments fused. That's it. That's regular shape. All right? So we only have 2 more things to go over. Ribs and sternum. The sternum right here is made up of 3 parts. The top is called the manubrium. The biggest part is called the body. And the bottom part is called the, what's it called? The xiphoid process, spelled XI or ZY, depending on your textbook. The xiphoid process can be spelled XY or ZI. And this is when on CPR, Annie, or UK, you in the black shirt, call 911, find the episternal notch, the xiphoid process, go up a little bit, so you're compressing the body, not the xiphoid, because the xiphoid can break off during CPR. And you don't want to do that because I don't know what's over here. Lung, heart, depending on how you push hard enough, you can go through the diaphragm, hit the liver or the stomach. So you don't want to press too hard on the xiphoid process. All right? If we have a lateral curvature of the spine that goes one way and comes back, that's a scoliosis. If the mid-back is too arched or curved, they call that a lordosis. Hunchback could have fat, and that's more of a dowager hump, which could be thyroid, but yeah, kind of. Now again, posture is everything. If you don't stand up straight, guess what? You're compressing your lungs, and you're putting pressure on the top of your vertebrae. The more pressure on there, the more arthritis you can get, and the more weaker they can get. So you always want to stand up straight. Okay? Actually, it's funny, your plumb line is your external auditory meatus, your EAM, should be above your olecranon process of scapula, which should be above the acetabulum when the femoral head meets the acetabulum. It should be through the middle of the joint, behind the patella, going between tibia and femur, and it should go through the lateral malleolus of fibula, and that's your lateral plumb line for posture. No one ever talks about that. Okay. Ribs are next, and then we're done. It's simple. We have 12 pairs of ribs. The first 7 are true ribs. They attach to the sternum directly. 7 are true. 8, 9, 10, 11, and 12 are false. But number 11 and 12 are called floating ribs. They're still false, but they do not attach via cartilage like 10, 9, and 8 do below the cartilage below 7. So 1 through 7 true. They attach to the sternum via cartilage. 8, 9, and 10 attach to the cartilage below the 7th rib. They're called false ribs. 11 and 12 are also false, but they're also called floating ribs. They have no anterior cartilage attaching them or anchoring them to anybody else. Now again, this is a normal individual. Can you have a cervical rib at C7 as abnormality? Yes. Can you have agenesis of a rib and missing a rib? Yes. Can you have 13 on one side and 12 on another? Yes. So every time you have textbooks normals, then you also have abnormal variations or deviants. Okay? So, if anyone wants to see the soft spots in baby skulls, I have a child skull over there. They're called fontanelles. There's several fontanelles in the baby because, again, the skull doesn't fuse until you're older, and also they need to be movable. So when the child passes through the birth canal, the skull bones kind of move over a little bit. You know when the baby's born, they put that cap on the baby as soon as they're born. Why? So mom doesn't see the deformity of the baby's skull, because they'll flatten out in a couple days, but at first some of them can be coney. Okay? I made up that word, cone heads. All right? So that's it. That's your quick review of the axial skeleton, and you guys are going to do great, okay? Thanks.